talk to you about making the world a better place one smile at a time. Periodontal disease is one of the most commonly diagnosed conditions that I see being a veterinary dentist, and it's one of those things that it is easy to diagnose, and in some respects it's going to be easy to prevent as long as your pet is compliant and as long as you make the commitment to that and to your patient. So today we're going to talk about the definition of what periodontal disease actually is and how it occurs, the clinical signs that we see of disease, how we diagnose it, treatment options, and then the prognosis, and then how do we prevent this disease from occurring. So periodontal disease in general is an infection and inflammation of the hard and the soft tissues that hold the teeth in the mouth. So the predominant tissues that we're talking about are going to be the gingiva or the gum tissue, the alveolar bone or what the teeth actually sit in, the periodontal ligament. And think of the periodontal ligament as the shock absorber. It's the ligament that allows our teeth to actually move and have some physiologic movement within the mouth. And then the cementum, which is the outside covering of the root of the tooth that attaches to the periodontal ligament. So to give you an idea here the gingiva is going to be the soft tissue of the oral cavity. So any breakdown or loss of that soft tissue, if you had some gum tissue recession or if you had some pocketing around the teeth, any loss of that gingiva would constitute some level of periodontal disease. The alveolar bone is kind of going to be the bone of our lower jaw or our upper jaw. That shock absorber or the periodontal ligament attaches the tooth to the bone, and the cementum is this thin layer that surrounds the root of the tooth. So any breakdown or loss of any of those four structures constitutes some level of periodontal disease. So it's interesting to note, but studies have shown that by 3 years of age, 80% of dogs and 70% of cats are diagnosed with some level of periodontal disease. It's also going to be one of the most common clinical conditions that we see as veterinarians that occur in adult dogs and cats. If left untreated, we can see multiple issues, and these are related to the oral cavity, such as loss of the teeth, pain, infection. We can see oral masses that may be caused by some irritation in the mouth that is also caused by periodontal disease. And then we can also see some damage to the internal organs. So the damage to the organs, when we take something in our mouth or our pet takes something into their mouth and they have inflammation and infection in the oral cavity, that can cause some bleeding. That bleeding then harbors bacteria. So our mouth is not sterile, but it can harbor bacteria. And then that bacteria can go to the heart, to the kidney, to the liver, to the brain, to the bladder, and it causes white blood cells to accumulate not only locally in the oral cavity, but they're trying to fight that bacteria that we have allowed to go to the other systems in the body. So we do see that there can be some link to some cardiac disease and periodontal disease. Sometimes if we have patients that are diabetic, all the sugar that is spilling into their urine and into the blood because of not being able to regulate their blood sugars, that is going to feed this bacteria, and that can cause more infections to occur in our patients. So if we have a healthy tooth here, this picture kind of depicts a healthy tooth with no inflammation or infection around it. Bacteria, food debris, and saliva, they cause a biofilm. So if you brush your teeth at night, by the time that you wake up in the morning, you have a film over the tooth. That is a biofilm. So that is kind of depicted in this image here. So the bacteria, the food, and the saliva form a biofilm. And then that biofilm eventually matures and starts to mineralize and causes plaque. Plaque begins to cause a little bit of an inflammatory response because it is foreign material that is sticking to the tooth surface. So you have the plaque that sticks to the tooth surface that then in turn causes some inflammation of the surrounding gum tissue. Once those minerals begin to harden, it turns into calculus or tartar. Tartar is usually something that we use more so on the human side, or the term. Calculus is something that we use a little bit more on the canine and feline side. So on the dog and cat side, we use calculus a little bit more commonly. The two terms kind of can be used fairly synonymously with one another, but the interesting thing is that there are some microscopic differences between the two of them, and then location issues. So that calculus and tartar attaches to that tooth surface, and then the inflammation causes bleeding, and then more and more plaque buildup occurs, and then that can eventually cause some loss of some of the gum tissue, and or it can begin to have some loss of the bone that is associated with the holding of those teeth actually into the jaw. Advanced periodontitis, you can see significantly deep pocketing. You can see the loss and the inflammation of the gum tissue as well. The big thing is that tartar itself is not really the problem if it's on the crown of the tooth, but what the problem is that the plaque and the calculus that goes below the gum line, it causes almost like a foreign body or a foreign material reaction. So you know that if you eat popcorn, get a popcorn hull that is stuck below the gum line, you know, if we eat popcorn, it's okay. It becomes irritating once it goes below the gum line. That's the same premise by where plaque and calculus below the gum line causing inflammation. That's where the problem lies, and that's how periodontal disease begins. So the bacteria below the gum line cause the inflammation to those hard and soft tissues. But honestly, the inflammation depends on what the animal's immune system is like. The patient's immune system is worsened by the animal's own body because they're trying to protect against the disease. If animals have an overactive immune system, then it can cause a really amped up inflammatory process. This is commonly seen in the cat with the condition that is called gingiva stomatitis. In the dog, it is also a gingiva stomatitis, but it's something that they call CUPS, which stands for chronic ulcerative periodontal stomatitis. But both of those are a hypersensitive immune response. In the cat, it's more of a hypersensitive immune response to either plaque bacteria in the mouth, plaque retentive surfaces, so the teeth, or the periodontal ligament. So really the only treatment for that is meticulous home care or extraction of all the teeth. For the dog, it is really just a hypersensitivity to plaque bacteria in the oral cavity. So meticulous home care, frequent dental cleanings, and the owners bringing them in very periodically or very frequently for dental cleanings is what helps those particular patients. We do sometimes need to resort to extraction of either the strategic teeth or extraction of the teeth that are causing the most issues. So this would be an example of, we have a cat that has some the feline stomatitis or the gingiva stomatitis. You can see that there's some proliferation or growth of some of the gum tissue in the back of the oral cavity. These cats are really, really irritated, really, really inflamed, but you have to have this hallmark sign of having this inflammation in the back of the mouth, and along with having some significant inflammation around the gingiva itself. For cups, usually you see what they call these kissing lesions, where you see kind of the imprint of the tooth on the cheek tissue or the buccal mucosa. These guys usually lose a little bit of gum tissue, has some exposed root as well, but this is one of those hallmark signs for cups too. In general, clinical signs of periodontal disease include bad breath, and that's most commonly what pet owners come to me with, is they're like, you know, we really think that the dog or cat has stinky breath. We also can see gum tissue or redness, bleeding of the gums, tooth discoloration, but that's usually related more so to the teeth having the tartar, the calculus, and the plaque on it. Problems picking up food or dropping food, maybe they kind of tilt their head to the side and you see food drop out from there, or blood in the water bowl or on chew toys. Maybe they're seeing a little bit more kind of gingivitis and irritation, and therefore they see it on the toys, on the rope toys. So this is obviously an extreme case of having calculus, but all of this stuff that almost looks like cookie dough smashed into this poor pup's mouth is all calculus that's hardened. You can see that there's also these little fissure lines that are through kind of where the teeth are, and that's because those teeth are mobile. So they're like piano keys. So they're moving. The only thing that's holding these teeth in the mouth is the calculus that is on that tooth surface. Here's a cat, and you can see the extreme redness and inflammation of the gingiva. So that kind of gives us our gum tissue redness. And then here, all the heavy calculus. You can see the heavy plaque that's almost like cottage cheese on the surface, some of the swelling to the gum tissue as well. So all of these would be signs of periodontal disease that we can see in our patients and in our pets. We can also see some bloody saliva, chewing on one side. Sometimes we see animals that actually come in and the teeth are physically loose, like I can move them on the conscious exam. Some more subtle signs are not wanting the head touched. Maybe they have a sore tooth, so they'll kind of shy away, or they don't necessarily want to have their face pet or rubbed as they normally did. Extreme signs of advanced periodontal disease can also be sneezing or nasal discharge, and that's usually because the disease has progressed so far that there's bone loss enough to cause a communication between the mouth and into the nasal cavity. So sometimes they will sneeze food chunks out of their nose, or they'll have some chronic nasal drainage or chronic nasal discharge that could be associated with it. Here you can see that we have a canine or a dog patient. You can see the heavy calculus that's on the tooth surface, and you can actually see how the line of the gum tissue is also lost a little bit, and it goes in the waveform of how the calculus has been deposited on that tooth surface. This here would be a pretty extreme case of periodontal disease. We're actually missing some teeth here. Here you can see between the roots, these teeth are actually probably mobile in this particular patient's mouth, but this one may not want that head touch because of the fact that these teeth are mobile and they hurt. So for our diagnosis of periodontal disease, you want to take your pet to a veterinarian for a true oral examination, and they will look at the conscious oral exam and then assess a plaque and calculus score. These are usually graded on a scale of 1 to 3. To truly diagnose periodontal disease, though, you need an anesthetized oral exam. And you need a professional dental cleaning under anesthesia. So that would entail scaling. So that's cleaning off all of the gross calculus or all of the hard calculus that you can see off the tooth surface and the plaque. And then you follow that up by polishing. So when we scale the teeth, the scaling itself causes these little micro etches or little micro cracks in the tooth surface. The polishing then smooths that off. If you skip that step, if you skip that scale, or if you skip that polishing step, it creates the little cracks that bacteria and plaque and food debris and that biofilm can set up a better shop, and it can cause more issues in that respect. And it makes it easier for the calculus to stick to the tooth surface. Then your veterinarian will hopefully do a tooth by tooth assessment, looking at all the different spots around each tooth, evaluating them for any pocketing or mobility, seeing if they can move or wiggle those teeth. They will try to measure any gum tissue loss or any bone loss that's associated with it. And then radiographic evaluation of each tooth is also going to be able to give the veterinarian more information as far as for an assessment and an overall assessment of what's going on below the gum line. So when we look at our calculus scoring, I look at this kind of a little bit simplistically. There are a ton of scores out there, but I look at it as, is there just a little bit of calculus that I can see on the tooth surface? Is there more tooth surface than calculus showing, or is there more calculus than tooth showing? So a little bit more tooth than tartar or calculus showing, or more tartar or calculus showing than tooth. For gingivitis, I look, is there a little bit of inflammation? If I poke it, will it bleed, or is it already having a significant amount of redness and it's probably already bleeding? So those are my calculus and gingivitis scores. Our assessment for periodontal disease, as far as for treatment, is early recognition is imperative to try to prevent tooth loss. And that's going to be the most important thing that we need to look at. As pet owners and as people concerned about the dental care of their pet, you need to give a thorough history And that's going to be food preferences. Do they prefer hard food versus soft food? Has there been a change? Is there a change in their eating habits? Are they dropping food? Are they not eating as much? Are they not as excited to eat their food? And is there a change in their daily activities? Are they not as interested in toys as much as they were? Are they not interested in chewing hard things or playing tug? All of those things when you're exercising or playing with your pets, these are the things that you need to give your veterinarian as far as for a thorough history. Then the anesthetized oral exam, the dental cleaning, and the radiographs. So these are some examples of some radiographs of some, kind of moderate to severe periodontal disease that we can see. Here you have a tooth that is very close to where the bottom of the jaw is, but it also has a lot of bone loss that's associated with this. So a tooth like this is always going to be concerning because we're going to be concerned about if we remove this tooth, are we going to break or fracture the jaw? If we let this tooth go, though, the animal itself, by chewing on something or tugging the wrong way, can break their jaw. They call it a pathologic fracture. So something like this needs to be addressed beforehand so we can get this tooth out of there so that we can then allow the bone itself to heal so it won't be as much of a concern. Here you can see that there's hardly any bone that is holding in any of these 3 teeth. So all of these teeth are likely going to be mobile, and all of these teeth need to be removed. Here you have a similar kind of patient to this one, but that big first molar tooth is very healthy, but the one behind it is very unhealthy in the fact that this first root here, the mesio root, has minimal bone that's actually holding it into the jaw. This one still, this back root or the distal root definitely has enough bone in there to keep it, but one root is not going to help you out. So you're going to have to remove this tooth as well. Here we have some evidence of periodontal disease in a cat. This is a cat jaw. You can also see a little area where it almost looks like that someone has taken a bite out of the center of this tooth. So this cat has some bone loss that I would consider being horizontal bone loss, as well as some evidence of tooth resorption. So dental radiographs really help you to figure out what is going on in the pet's mouth, especially below the gum line. And then it allows us to make sure that we can get all of these teeth out, or if we're seeing any surprises or any concerns that we have and care we need to take specifically to get these teeth out. So if your veterinarian finds that there's too much attachment loss, most of the time they're going to put in nerve blocks. Just like you or I, if we had any dental care done in our mouth, they would stick the Novocaine in there to block us so we don't feel it. That's very commonly done in dogs and cats as well. So we're going to put nerve blocks in to try to block the pain that's during the procedure, as well as many times post-operatively, dependent on what is done. So after the procedure, they're still getting some of that pain relief from the nerve blocks. We may want to do some below the gum line cleaning. So clean out some of that debris, some of that food particles, some of the plaque from the pockets. And then we may need to consider surgical extractions or kind of what they call quote unquote non-surgical extractions, dependent upon how severe the periodontal disease is. We're going to provide pain control after the procedure, and this is usually through either opioid medications like tramadol or morphine derivatives, or non-steroidal anti-inflammatories, something like a doggy version of aspirin. Those are usually sent home after these procedures as well. Sometimes dependent upon the patient, dependent upon any pre-existing conditions, we may send home oral antibiotics. Most of the time I will tell you I don't send home oral antibiotics unless there is a specific reason why. So I follow what the American Heart Association standard does as far as for when they send antibiotics home in humans. And it's a very, very small category of situations in which antibiotics are actually warranted. After the procedure, you're going to follow up with the veterinarian, usually in 10 to 14 days, especially if they've done any extractions, just to make sure that everything healed up okay. And then dependent upon how severe the periodontal disease was diagnosed, your veterinarian may have you look at anywhere from 6 to 12 months following the procedure to have either another anesthetized exam or at least a conscious exam to see if the home care and the follow-up you're doing is going to be is working to try to help stabilize the periodontal disease that they have. So stage 1 periodontal disease is reversible. So stage 1 periodontal disease is going to be just gingivitis. We can reverse inflammation. We can reverse it with medications. We can reverse it with home care and brushing and the dental cleaning. Once we start to lose those 4 structures, so remember the gingiva, the alveolar bone, the cementum, and the periodontal ligament, once we start losing those structures, this becomes a non-reversible condition without some what I kind of jokingly refer to as periodontics. So bone grafts, gum tissue replacements, and a lot of times those procedures are not necessarily very successful. The one thing that we do need to remember is that periodontal disease is based on an anesthetized exam, intraoral radiographs, and periodontal probing. I can't just look at this mouth and say what stage of periodontal disease is going on because I can't see below the gum lines and I can't see where there's any pocketing. So when you are looking at a patient or you bring your pet in, they can maybe give a blanket statement of saying that they have periodontal disease, but unless you have x-rays and actual probing around the teeth, you can't truly diagnose how severe the periodontal disease is. So our prognosis, if we have the kind of the stage 1 where we just have inflammation, controlling the inflammation again with dental cleanings and home care, and this could be daily brushing, diets, rinses, some dental chews, some sealants, those sort of things are going to help to control the inflammation. We do have some medications that we can use. There is an antibiotic medication that does have some anti-inflammatory properties that I use frequently for this as well. So those things can help to try to control the inflammation, so antibiotics and anti-inflammatories. If you have stage 2 periodontal disease, which is going to be some inflammation with less than 25% attachment loss, and that's of any of those 4 structures of the gum tissue and the hard tissues, some aggressive non-surgical below the gum line cleaning is going to be warranted. Your veterinarian may apply some medication down into the pockets to reduce the inflammation. And this all helps to try to promote the regrowth of all of those 4 structures, or worst case scenario, some scar tissue. But if you have less than 25% attachment, you have a fairly good prognosis for stability. We probably won't gain any attachment, but at least we can try to keep things at bay and keep things stable. If you have 25 to 50% attachment loss, you may need to get more aggressive. You may need to have some surgical intervention by creating some flaps and doing some below the gum line cleaning and removing all the granulation tissue so that you have a really nice clean root surface in hopes to try to regain some of that attachment. This may be an indication where you put some bone grafts and again some other medications into the pockets to try to reduce inflammation, to promote the regrowth of those attachment structures. For this, you kind of have a fair prognosis for stability. If you have greater than 50% attachment loss, it's kind of extractions are going to be likely. It's going to be difficult to regrow that alveolar bone, and it's difficult to regrow gingiva. Mother Nature likes to grow bone from side to side. She doesn't like to grow it up. So you might fill in some of the defects this way, but the chances of actually growing the bone from the root of the tooth back up to the crown of the tooth is going to be pretty unlikely. So these usually have a fairly poor prognosis for stability. But prevention is the key. Dental home care is the best way to help prevent periodontal disease from occurring. So when the pet is young, or after a professional dental cleaning and an oral exam under anesthesia, this is the best time to start. The one thing that I would tell you is don't just decide that you're going to start without having anyone have taken a look in at the oral cavity unless your animal is under a year of age. So there's kind of a happy medium because you don't want to start with the baby teeth because the baby teeth themselves when they become loose, they can be a little bit painful. So after the adult teeth have erupted, which is usually right around 5 to 7 months of age, and before a year, that's usually when you want to start a home care regimen. But you definitely want to, if you have a 3 or 4 year old animal and the teeth look pretty okay, you don't want to start doing that then, because there still could be things in that oral cavity that might be painful, and you don't want to have that animal associate um, brushing with something being painful. So brushing is our gold standard, ideally once a day, and it is truly just to reduce the plaque and the film and the biofilm off the oral cavity. You want to start like in a circular motion on the outside surface of the teeth. The inside is a bonus because the little barbs and the little papilla on the tongue, that usually cleans the inside surface. If your patient or if your pet is tolerant enough that you can brush the inside, that's great, and do it, but concentrate on the outside surface. So when you are going to be toothbrushing, find a time when the pet is relaxed, set a routine, brush daily to prevent the buildup, because again, that plaque accumulates right after a dental cleaning. The plaque accumulates daily. It begins to mature into the calculus right around 24 to 48 hours. Always use a toothbrush, and this can be a human toothbrush or it can be a pet toothbrush. It doesn't make any difference. I tell my owners that, give the pet your old toothbrush and you get a new one. You can start with those little finger brushes, the ones that have the little nubs, and they're okay for starters. But what you really need to do is graduate up to an actual toothbrush at some point so that you can get above the gum line. So this would be an example. This is a dog and a cat toothbrush. It has this bigger end and it has kind of this curve or slant to it. So it's supposed to be ergonomic so that it allows to follow the junction of the narrow snout and then goes out to kind of the cheek portion of your pet. Here's the little brush portion. Cats also, some owners like this kind of almost cone or pyramid shaped head to this as well. But again, these are just human toothbrushes. Just use a brush. That's all you need. And it can be a soft brush. As far as for toothpaste, in theory, it's not needed. It should be a treat. So if your pet likes it, then great. If your pet doesn't like it, find something else like canned food. A lot of the pet specific toothpastes are poultry flavored or peanut butter flavored or vanilla mint. So, if they like it, that's great. If they don't, dip it in chicken broth, dip it in tuna broth, dip it in beef broth. Whatever you have, something that your pet likes, put some squeezed cheese on there. But the big thing is never, ever, ever use human toothpaste. Human toothpaste has things in there that we can tolerate as humans, but dogs and cats can't. And the big thing is that we as humans, we brush our teeth, we swish and we spit. We can't train our dogs and cats to swish and spit. So human toothpaste was not meant to be consumed. So the act of brushing is way more important than using toothpaste. And you can just use water. That would be fine too. So, choosing a product that is safe and that your pet likes. As far as for toothpaste, that's the most important. So when you're going to begin this daunting task of trying to start to brush, find a non-threatening place for you and your pet. Don't hold your pet down, because then they're going to get anxious and they're going to associate this with being something either playtime or being something that's not playtime and much more threatening. Don't stand above, looming above your pet either, but kneel off to the side or set off to the side of your pet. For cats, you can hold them in your lap, or small dogs as well. And you could wrap them in a towel like a burrito. So the only thing that is sticking out is just the head, so you don't have to worry about paws and claws. If the pet seems anxious, try again later. And depending upon the compliance of your pet, you may to repeat these steps over and over so that they can become accustomed to the positioning before toothbrushing. So hold them, let them go. Hold them, let them go until the anxiety for being held in a position that might be strange or foreign to them goes away. Once the positioning seems to be comfortable for everybody involved, then begin rubbing your finger along the gum line and the teeth and test their willingness to allow it. If the pet gets used to the feel of something against their teeth and it allows them to not be so anxious about it. Use just a really light pressure. And again, compliance, you might need to do this multiple times and repeat these steps to get them to the accustomed to the feeling of something being in their mouth and to the feeling of toothbrushing. Once you kind of graduate up, put toothpaste or the canned food, the squeezed cheese, the tuna juice, whatever on your finger and let the pet lick it off. It allows them to get used to the texture and the taste. It also allows you to see if they like that particular flavor. But again, this should be a treat. This should not be something that they're, forced to do, and because that will just give it a negative feeling towards them. And then after you let them lick it off your finger, then go ahead and you can put it on the toothbrush. Let them lick it off the toothbrush because now they can feel the bristles. Now they can feel the treat on the bristles, and it allows to associate the toothbrush with the treat and allows them that familiarity with the toothbrush in or near the mouth. Now it's time to start to try brushing with the toothbrush. So apply it to the surface, kind of angled towards the gum line at about a 45-degree angle against the teeth. And then just gently massage the gum and remove the plaque in circular motion. It doesn't need to take a long time. So you can kind of brush, brush, brush on the outside, brush, brush, brush up front, and in small circular motions. And depending upon the compliance of the pet, let them, you may need to repeat these steps. So let them become accustomed to being in the mouth with a toothbrush. So here, kind of in that circular motion, angled towards the gum line. Same thing with the cat. These are kind of the steps that you're going to want to take. If you encounter bleeding, your pet might have some gingivitis, so a small amount of bleeding can be normal. But if it occurs each time you brush, then we need to kind of reassess what's going on, or if you encounter heavy bleeding. So you might be brushing too aggressively. Your pet may have more advanced periodontal disease than what was previously diagnosed. So ask your veterinarian for advice. It may not even be related to the oral cavity. It may be something such as a bleeding issue or a bleeding disorder, or there can be a number of different reasons. But if it occurs every time that you're brushing, definitely ask your veterinarian for some advice. The big thing is don't attempt the entire mouth the first time. We need to set ourselves with some kind of small goals. So just a few teeth at a time, one side at a time, perhaps, and then work up to the entire mouth, which may take days to weeks to months, dependent upon the age, the compliance, and the anxiety of you and your pet. So it's one of those things too, in which if you have high anxiety, they're going to sense that. So you both need to be comfortable with what's happening. Plaque commonly accumulates mostly on the canine teeth, so the fang teeth, and then the premolars that are towards the back and the back teeth. So you need to concentrate on these teeth to try to help keep them the cleanest. So don't worry as much about the inside surfaces of the teeth because, again, the tongue is going to clean that area. So be supportive of your pet. Tell them what you're doing because maybe if you walk it and talk them through it, they're going to feel more comfortable as well. Pet them, give them breaks, give them treats to make it a really positive experience. And then when they're finished, reward them with something that's their favorite thing. So you don't always have to brush in the morning. You don't always have to brush them at night. Maybe you're going to do it in the middle of the day. Maybe you're going to do it right when you get home from work. The purpose of brushing is truly just to get the plaque off of the tooth surface. For us as humans, we brush so that people talk to us. We don't have food hanging in our teeth. But for them, it is strictly to get that film off the tooth. So brush their teeth, take them for a walk. Brush their teeth, play with them with the laser pointer. Because eventually it will become a habit, it will become routine, and they'll be like, okay, we can put up with him brushing my teeth, and then I get what I want. Then I get my treat. Then I get my walk. Then we get to play. So the more it can become a habit or routine, the better off that you'll be. Other methods that owners may consider, veterinarians may consider, is there are some gels. So Oravet is a plaque prevention gel that binds to the tooth surface. It tries to repel food and tartar and debris from sticking to the tooth surface. It's usually applied after a dental cleaning where the teeth are super clean, and then the owners can apply it weekly. Think of this like chapstick for your teeth, so it repels other stuff from sticking to the tooth surface. Oral rinses, I think of oral rinses kind of like disinfecting a cow patty. It will only disinfect the outside surface. So it reduces the surface bacteria and can be used in combination with other products, but you have to start off with a clean surface. Otherwise, all you're going to do is just kill the outside bacteria, but you're not going to get into the tartar and the calculus that's off there. So I sometimes will also call it Febreze for the oral cavity because it does help to decrease bad breath, but you need to start with a clean surface for it to actually do some good for your pet. Dental diets are designed in all sorts of ways. Some of them have a kibble that's meant to promote chewing. Some of them, it's the texture inside as they chew. It actually will scrape the teeth as it chews. Some of them have components inside that will actually help to bind calcium so that tartar and calculus doesn't stick as hard, and it releases the calcium once it hits the stomach. So dental diets are great as long as your dog or cat doesn't just hoover up the bowl and that they actually chew. So it's better than nothing, but you actually have to have a dog or cat that chews their food and doesn't just suck it up. Dental chews are okay, but it's also dependent upon the contact time that they spend chewing. If they bite, swallow, it's probably not going to be worth your time. But if they really spend a lot of time chewing, they can kind of clean the teeth with enzymatic cleaning and mechanical action. And then some of them will actually apply a sealing or a coating to the tooth surface that will help to prevent the periodontal disease and the plaque and the tartar from accumulating. As far as when owners ask me about this product or that product, I refer them to this website. So this is a website that you can use, especially as veterinarians and as pet owners, because you can just access it at any point. But this is the Veterinary Oral Health Council. And this is a group of veterinary dentists and veterinarians that have made the pet manufacturers of diets that are related to the oral cavity go through a testing that is above and beyond what normal FDA regulations would be. So they actually have claims that say that whatever their claim is, if it says it reduces halitosis, if it reduces calculus or tartar on the tooth surface, that the claim is legit because there have been live animal studies that have been proven. And it's a high bar that is set. So not very many products have it out there, but you will see that it has this VOHC accepted or VOHC approval on whatever the product is. And I know I took a group of students in non-COVID times. I took the group of students like to Petco and PetSmart, and we really had to try to find some of these products, but they do carry them there. So if you look at the website, it will tell you, here's the name of the product, here's what its claim is. So it does have a claim for plaque and tartar. This is who makes it. This is how you can get it, whether it is a veterinary only product or whether you can get it as a consumer over the counter. And then what year it was awarded the seal. So it's divided into either dog products or cat products. But this is a great website, a great resource for you to use. As veterinarians, it helps us because it takes us out as the middleman. And for owners, you know that you can trust these products because they are safe for the pet and that their claim is actually legitimate. So in summary, periodontal disease is one of the most common conditions that general practice veterinarians see in dogs and cats. If left untreated, it can cause some damage to the other organ systems and to the pet. And we need to remember that the bacteria, the saliva, and the food debris causes a biofilm, which turns into plaque and matures into those hard barnacles of tartar and calculus that you can see on the tooth surface. That tartar and calculus, when it goes below the gum line, it causes inflammation to the structures that hold the teeth in the mouth. And those supporting structures, once they're lost, cause the different stages of periodontal disease. Once the attachment loss becomes irreversible, it leads to inflammation and pain and infection in the teeth and eventual loss to the teeth as well. So early recognition is the key, and to prevent it, we need anesthetized oral exams, professional dental scaling and polishing and dental x-rays to assess the level of disease. And none of this is going to work without some home care. So we need some dental home care, and that can be with the daily brushing, the sealants, the chews, and all of those things can try to help prevent periodontal disease. So I found this quote when I was kind of making this presentation, that you don't have to brush all the teeth, just the ones you want to keep. And that's a very true statement for that. So with that, I will entertain any questions. It doesn't look like that I have any on the chat. I don't know if there were any in the question and answer, at least at that point, but I would entertain any questions.
Dr. Mulheron, can somebody, after viewing this presentation, just start brushing their animal's teeth, or would you recommend an exam first?
So that's a great question. As far as I would recommend, if your animal is between probably 7 months and a year, you can probably go ahead and start. If they're over a year of age, I would say have an assessment or evaluation, ideally under anesthesia by a veterinarian, so that you can start off with a clean slate and you can start off with a clean palate, and you're not going to be behind the 8 ball trying to catch up and brush some of that stuff off. You shouldn't be able to brush off tartar and calculus from the tooth. My worst clients usually are dental hygienists, because they just scrape off the calculus and the tartar from the tooth, but then they don't finish it off with polishing. Because for you or I, when we go to the dentist, and this was one of those kind of a COVID situation, is a lot of dentists are not polishing the teeth. So I recently had my teeth cleaned, and I'm like, look, I'm not going to do this unless you're going to polish my teeth. And we as humans, because we brush every day, multiple times a day, and we floss, we usually just have plaque. So they're not scraping those hard barnacle tartar and calculus chunks off of there. And so what happens within that is the fact that it doesn't leave the micro etches on us, because unless we really are heavy calculus builders on our teeth. So I would really encourage you to have a veterinarian scale and polish the teeth first, and then try to incorporate brushing. The biggest concern that you have is if they do have a bad tooth, or if they do have a spot that's sore in there, you're not going to know it. And then every time you brush, they're going to equate, it's painful, so I don't want to do with it, and you're going to fight more. And yes, I can understand how your pet is going to hate it when we go back to, when everything goes back to normal and we're no longer just sitting here as their beck and call people for them. Can you comment on the hard chew toys, such as hard plastic ones that the dog whittles down? Yes. Okay, so whenever you are choosing toys, the biggest thing that you need to consider when you are choosing toys is you should be able to indent your fingernail into it and it leaves a mark, or it should be have some give and stretch to it. So i.e. nylobones. I see tons of tooth fractures, and then either subsequent root canals or having to extract the teeth because of nylobones, because of crown fractures to teeth. So nylobones, unless they're like those weird kind of clear ones that kind of do have that give and stretch, those are okay. Raw hides that have the knots on either end, I see tooth fractures. Antlers, I see tooth fractures. The pizzle sticks or the boar penis things that they have there, I see tooth fractures. Anything that doesn't have kind of that give and take, that is going to be that is going to be kind of a hard thing for them to do, because the muscles of mastication or the muscles of chewing can put down more pressure per square inch than what the enamel on the teeth is able to withstand. So, you know, any of the braided ones, so flat rawhide strips are okay, but the ones on either side that have the knots on either side, those are not ideal. The other thing that I would say is Kong toys. I like Kong toys, except for most owners like to put Kong toys in the freezer with water and canned food or peanut butter and yada, yada, yada to make them last longer. Once you put it in the freezer, then once you put it in the freezer, then it changes the consistency of the rubber in there, and then that itself can be a nidus for them to then cause tooth fractures as well. How often should my dog get his teeth cleaned by my vet? I never brush his teeth. Okay. So either way, it is dependent upon how heavy the calculus and the tartar accumulates on the tooth surface. So according to the new AHA guidelines, is that small animals, so that's going to be under probably 20 pounds, usually need to have their teeth cleaned every 9 to 12 months. Dependent upon if there's other disease conditions that are associated with it, so like cups, my cups dogs probably come in every 4 to 6 months for dental cleaning. If you do good home care and you brush the teeth and that sort of stuff, you can spread that out. I have I think she is a 12 or 13-year-old miniature poodle, and she's lost, I think, 3 incisors, and that's it. But the owners brush at least twice a day. So they are ridiculously committed to this particular dog, and they bring them in every 6 months to just have me take a quick peek in there to see if it's time for a dental cleaning. And then I'm like, no, looks like you're doing a great job. Like, I got to get my little plaque light out and actually look to see if I can find areas that would warrant cleaning. And if I can't, I'm like, nope, we'll see you in another 6 months. The big thing is, especially for all the pet owners out there, don't lie to your veterinarian. If you're not going to brush, so Karen, if you're not going to brush, then tell me you're not going to brush, and we can find another way. We can find something else that might work. And those sort of things, we can work together, or we just have to accept the fact that you're going to have to come in more frequently, or your dog or cat is going to have to lose their teeth eventually, if that's the case. Yes, this one was actually one that we did a root canal on. So he broke his tooth. He was chewing on something inappropriately, and he broke his tooth. But yes, they do have really big teeth, and we need really big special instruments for that. Absolutely.